Welcome to Lifeline, connecting you to positivity here in our community. Proudly sponsored by the Quantum Family of Businesses, WNZF News Radio, the Flagler County Education Foundation, and Flagler News Weekly. Thank you for joining us. Good morning, Flagler County. This is Danielle Anderson, your host of Lifeline Radio Show, bringing you the positivity in our community. And we have a special guest in the studio with us this morning. You want to say good morning, Angel?
Good morning. Good morning.
So for folks who don't know you, tell people who you are and a little bit about yourself.
You bet. My name is Angel Ribo, and I'm a PA, or a physician associate, and I have been in medicine for 25 years. I had a midlife crisis, decided to go to medical school, and ever since I graduated, I've been working in infectious diseases and primary care. So basically, my patients have often been patients who have HIV, hepatitis, and then they also need a primary care, so I manage that too. You know, they have diabetes, hypertension, or whatever else is going on with them. I'm often their primary care provider also.
So, since you said midlife crisis, what year did you how old were you when you got into medicine?
Oh my goodness. So,
25?
I was, I was 46 years old.
Wow.
When I decided to go to medical school, yeah.
So it's never too late to go.
It's never too late. It's never too late. I always tell my kids and grandkids, the only difference between successful and unsuccessful people are those who persevere and those who give up.
That's cool. So where do you currently work? And I know that you just recently picked up an award.
Yes, I work for Outreach Community Care Network, and we are a nonprofit community health center in Daytona Beach, Florida. And we are tasked with taking care of people who have healthcare needs, regardless of their ability to pay. We find some way of getting them funded so they can get healthcare, but we work in the fields of HIV, hepatitis, infectious diseases. As I mentioned, we also do primary care. Then we also do mental health care.
Wow.
We have psychiatry services, and we have LPCs that do therapy and psychotherapy with our patients. And then the other area that we work in is medication-assisted treatment for patients who are addicted to opioids and who want to get off opioids. So we get them into a medication-assisted treatment program, and then we also get them into counseling so that we can transition people off of an addictive substance into a more therapeutic medication at first, and which is substitute without the highs, but then get them hopefully totally off, and then being functional members of society.
So you're kind of like a full service. It's almost like a hospital.
We and our vision has been to create a one-stop shop because we know that folks who come to us often have a number of challenges, whether they be financial or mental health or substance abuse or whatever it may be. And so resources are always limited, and things that often we take for granted, like an automobile. A lot of our patients don't have automobiles, and they have to depend on public transportation, or they have to make do. And we have a number of patients who ride their bicycles, over to see us. And so we understand the challenges with having to go different places to have your healthcare needs met. And so we are trying to build a one-stop shop community healthcare center where patients can come, be treated with respect and kindness, and know that we care about them as people, and that we want to help them and provide them the assistance that they're ready for and that they need.
So you could have chosen any place to go to work. Why did you decide that this was the right place?
Well, I think it had to do with why I went to medical school, to PA school. I had worked at Parkland Memorial Hospital in Dallas for a number of years as a patient advocate and a Spanish interpreter, and I worked all over the hospital. And Parkland Hospital is the level 1 trauma center in Dallas. It's a county hospital where, again, all the indigent patients come. And so I started working with that population and began to see the need. Before that, I was in ministry, and so I've always had kind of a heart for helping people, and making a difference in people's lives. And
And your name is Angel?
and my name is Angel. There you go. And so it's easy to remember anyway, And so, I got involved in all areas of healthcare. I learned a lot being a Spanish interpreter and a patient advocate, working in every department in the hospital, including being in some surgeries to translate while patients were awake, while we had to keep them awake, with maybe the bottom half of their bodies being anesthetized, but they wanted to keep talking to them, make sure they were okay. So I had to be there to talk to them and translate for the anesthesiologist. So I decided I wanted to do something more, and so I was not a teenager anymore, and so that's why I decided not to go to medical school, because it was just going to take me too long to do that, and I was comfortable with being a team member in the healthcare team, and so I decided to go to PA school, and it's been the best decision I've made in my life.
My brother's a PA, and he really loves what he gets to do.
And it's wonderful. I love what I do. I think we certainly, being a physician associate, we are meeting a big healthcare need in the healthcare system, and we love taking care of our patients. People tell me, said, "Why aren't you retired?" I said, "I don't want to retire because I get more from my patients than I give to them. They mean more to me, and the satisfaction and the gratefulness that they show when we take care of them and provide services for them. You can't buy that, And as long as the old computer upstairs works, I plan to continue to do what I do, because I couldn't imagine doing anything else.
It's like we take it for granted that we have health insurance and that you can call your doctor and get an appointment, whereas some people may have to wait months or for a long time to get in to see someone, right?
Absolutely, and that's part of the reason why we at Outreach Community Care Network got into this whole mental health and substance abuse area, because our CEO, Dr. Chester Wilson, he was for many years vice president for Stuart Marchman in the area, and so he was very acquainted with that outreach that they did there. But they have like a 3 or 4 month waiting list, to be able to get in there. And they are really the only game in town here in Northeast Texas. I'm still in Texas. Northeast Florida. And so because of that, and because he's well known in that community, we were able to get a grant from the Department of Children and Families, and it's being managed by Lutheran Services. And so now we have funding so that we can, different sources of funding so that we can help take care of people for mental health and substance abuse and HIV, regardless of their ability to pay.
And I think Chester Wilson, I was at an event for the African American Entrepreneurs Association. He just picked up an award.
Yes, Chester and we've become really good friends. I always say that God works in mysterious ways. And when I ended up at Outreach, he and I immediately clicked, because we were people of like-minded and like heart and like values, and we both wanted to serve and make a difference. And frankly, when he took over the agency, he was not doing well and was failing, and we got there shoulder to shoulder together. It's been a long road, but as of January of this year, we're out of that and we're in the clear, and we're just growing by leaps and bounds. Our only problem right now is actually finding qualified staff to be able to hire so that we can assist the number of people that are reaching out to us.
It does seem like there's been an exodus from the medical field since COVID.
There's been an exodus in many ways. Some people have changed careers because they had to, others because they wanted to, others decided they're not going back to work. And I'd like to know how they are managed that.
Wow.
But regardless, there's a big change, and in healthcare there's always a big need. There's always more need than we have resources to be able to help people, and but yet the reward is how the patients are so grateful to have their needs met and to have people deal with them as real human beings and that understand that they're in a difficult situation. I often tell medical providers, I do a lot of presentations for medical providers, and I often tell them, I said, we who are in the healthcare field, we're in a very privileged and unique position, and we are placed in such a way that the people that come across our lives are often there without them planning to be there. Is because something has happened in their lives that they find themselves, usually in a moment of despair, often anxiety, it's often pain, and a lot of fear. And they come to us, and we have the unique ability to speak into those lives in a manner that is caring, that is knowledgeable, and that it actually impacts the whole person, and it makes a difference in their life. And we could be here an hour. I could be telling you stories of patients and things they have told me that prove that out. Even after I was a PA student, I'll tell you one quick. And I had a lady that was remember me from when I was an interpreter, and she came up to me when I was doing my rotations for OBGYN, and she said, she was Spanish speaking there in Dallas, and she said, "Are you Angel?" And I said, "Yes." She said, "No, you don't remember me." She goes, "But," she told me the time period, I don't know, a few years earlier, she had been to the ER. She said, "You called me and told me that my son had been in a really bad wreck. I needed to get to the ER." And she said, when I arrived, she goes, "I didn't speak English. Didn't know what was going on. My son was real critical." She said, "You stood by my side." She said, "You helped me." And eventually said my son was taken up to surgery and I didn't get to see you anymore. She says, "But I've never have forgotten you." She said, "Because I don't know what I would have done if you would not have been there that day for me." And she says, "And I want to tell you that my son made it. And he was okay. And I just never got to tell you thank you for what you did."
So you can see your faith, where your faith-based foundation really comes through.
Well, it's just, to this day, it brings me to tears, because did I remember that lady? No. But the important thing was that she remembered.
And you made
She remembered, and as I told my mother-in-law, was a very strong woman of faith before she passed away, and she had Alzheimer's, and she didn't remember many things. She would say, I said, "Mom, you were an amazing woman of God." I said, "You did lots of things to help a lot of people." And she would just look at me, she goes, "Really? Did I do all that?" And I would tell her, "Mom," says, "the important thing is that even though you don't remember," I said, "the Lord remembers." And when you get there to see him, he's going to look at you and say, "Well done, good and faithful servant."
Where's the Kleenex?
So we do it as unto him. And so he loves all of us, and we love everyone, and we obviously, as with my own children, I don't always approve of what everyone does, but although often even with my own children, there have been period of times when they were not very happy with me and I was not very happy with them, but not once did I ever stop loving them.
Never.
And so it's having that unconditional access to me. And as I tell my patients, you may not do what I recommend, but I'm always here for you.
That's awesome. So we're going to take a really quick break, and then we're going to talk about why you're really here.
Okay.
Be right back.
It's time for the Flagler County Education Foundation's annual Mardi Gras event. Get your tickets today at flagleredfoundation.org.
All right, so we're back here, and we're talking with Angel. It's like an angel of mercy here in the studio this morning. So tell folks a little bit about the award that you just picked up, and we're going to talk about this subject because it's a really important topic that people have a lot of misconceptions about.
Well, Point of Care Network is a national network for PAs and nurse practitioners, and they emphasize a lot of networking and educational opportunities for both PAs and NPs. And I've been involved, obviously, with them for a number of years, and I've also been an educator for a number of years, public speaker, and I have been working with them and 3 other colleagues developing an HIV Center of Excellence, which is a resource website for providers who are low volume providers, or providers who don't have a lot of experience treating HIV and AIDS as myself. And they're able to go there and be able to have resources of information that will assist them in their patient care. And so in working with POCN this year, they really just honored me with 2 awards, actually. They gave me the award for Infectious Disease PA of the Year, which was quite an honor and very humbling. And then, like 2 months later, they contacted me and said, "We want you to know that now we've selected you for PA and NP Educator of the Year award."
Wow.
And so again, the older I get, the more I know that I don't know, and the more things like these humble me, because no one knows my own limitations more than me. And I understand that, when we make ourselves a tool to help others, I really believe God uses us to make a difference in people's lives, and often in spite of us, thankfully, And so, and so that's how I view my service in the medical field, that I'm there at that moment to love people and educate them, about their disease state, because people need to know what's going on with them. I take the time to do that and answer their questions.
So I'm going to do some rapid fire questions for you.
So,
We've got like 10 minutes
sure.
left. So for people who don't know, December was HIV and Hepatitis C Awareness Month, right?
Mm-hmm.
So, our health department here was on December 28th, did a testing for people. But people who may not be sure, can they get tested anytime?
Absolutely, and I think people should get tested anytime. I often say there are 3 basic urges or needs of human beings. That's eating, breathing, and reproducing. And sadly, in healthcare, we take a lot of concern about what we're eating. We talk a lot about that. We also talk a lot about what you're breathing. We shouldn't smoke. Don't be around asbestos and all of that. But often sexual life gets ignored, and there's no conversation about healthy choices or healthier choices that can be made, and prevention that can be made. So I think it is a very important topic to be made, and thus regular testing is important, and everyone should know what their status is of HIV. If you don't know, you should know.
So if you're not on the dating scene, you're kind of scared to get back out there, and you see all these commercials that are saying folks can take pills to prevent it or to lower your status. Can you explain what those differences are?
Sure. And I often tell young people that if I was young and I was sexually active, there would be 2 things I'd be doing. I'd be using condoms all the time, and then I would be on what we call PrEP, pre-exposure prophylaxis. And that is taking medication that would prevent you from getting HIV in case you came in contact with it. You can either receive PrEP by a pill that you take once a day, or you can get, now it's available in an injectable form, that you can get an injection first every 30 days for 2 months, and then every 2 months you just get an injection. It protects you from HIV. But we recommend that both condoms and PrEP be used, because there's 3 things I know about condoms. Number 1, everyone should use condoms. Number 2, not everyone uses condoms. Number 3, even when you use condoms, they break. And so those are the 3 things I know for sure about condoms, and I try to share that with my patients, why I think it's important that you wear condoms if you're sexually active and you be on PrEP.
So talk a little bit about the commercial that says this lowers your transmission.
Well, that's for patients who are positive.
Okay.
The PrEP is for patients who are HIV negative, to keep you from getting HIV. So that is on the prevention side of the scale, if you will. So just like you go to the doctor, and your doctor should be talking to you about preventive things you can do: eat well, exercise, etc., don't smoke, number of things. This is also on the preventive side. The best treatment for diseases, don't get it.
Prevention.
Don't get it in the first place.
And what are the numbers as far as like people actually being HIV positive?
Yeah, I mean, there's about 30,000 new infections in the U.S. every year. We pretty much have plateaued at that level consistently over the last several years, and that's because, unfortunately, at the primary care level or at the frontline level, people are not testing, and providers are not testing routinely, and are not having these conversations with their patients.
How often should someone get tested?
I think it depends on the individual, but you have sex pretty often, and as a young person, and a lot of young people have multiple partners, and every time you have multiple partners, you introduce a different variable, and so you should be tested as frequent as your risk is.
So do you go like the next week and get tested? Do you wait several months? Do you wait a year?
Well, ideally, you should wear condoms and be on PrEP, and then you won't have to worry about it as much. But if you do need to be tested, you should be tested anytime you're concerned. Now, the guidelines are that everyone should be tested at least once in their lifetime.
Oh.
But I don't know too many people that only have sex once in their lifetime. And so I don't know how practical that is, but that is a bare minimum, obviously, or even once a year can be a lot. I mean, unless you're in an exclusive monogamous relationship with you and your partner, and you both know what your status are, and you're comfortable in your trust factor, because even unfortunately, as life is, some people think they're in an exclusive monogamous relationship, but their partner doesn't think that.
Right.
And then, problems get introduced into the relationship unknowingly to the other partner, and then they have the consequences that come with that. So certainly if you're not in an exclusive monogamous relationship, you certainly should be getting yourself tested, but preferably you'll be using condoms and being on PrEP.
And so what happens if you test positive?
If you test positive, you should begin treatment immediately. And the great thing about now is that HIV has changed from a terminal disease, which means you're going to die from it, to a chronic disease, which means that although we do not have a cure, you can manage it and you don't have to die from it, like diabetes and hypertension, for example. Those diseases, if you don't take care of them, you will die from them, right? And HIV is the same thing, right? But if you eat well and you take your medication, you probably are not going to die from hypertension and diabetes. And if you do that with HIV, you won't die from HIV.
So talk about someone being diagnosed or test positive. What do they do as far as like moving forward with sexual partners? How does that conversation happen?
Yeah, actually, I had a lady just this week that I saw, and she was a very classic case for what we're talking about. She's about a 58-year-old woman who just found out that she was positive. By her counts, she's had it for a little while. I don't know how long that is, because we really can't tell how long it's been. But she's been with the same partner for 7 years.
Oh, wow.
And he's negative. And so there you go, and we talked a lot about it. She was like, I don't know, how could I have gotten it? I don't know. I tell her, I said, well, I don't know either. I said, but I can tell you that the only way you get it is through exchange of body fluids, through sex, exchange of body fluids through sharing of needles with IV drug use, or even sharing of needles with diabetic supplies. And I know in poor families sometimes that you have diabetes in several generations, that's been a risk factor. That's been there.
Sharing straws?
Sharing straws, no. Orally, you can get it through oral sex, but there's no documented cases with the CDC as long as we've been tracking HIV with kissing.
Okay.
But there are documented cases of people getting HIV through oral sex.
Now, in her case, does she go back and say, I just won't have sex with you anymore? Or
well, so there's a couple of things. Of course, you need to have that conversation with your partner, obviously. But then the next step after that is that we get her on treatment. If the patient becomes undetectable, which they do through treatment, then they do not transmit HIV any longer. So that's when you see the commercials that undetectable equals untransmissibility. So for the patients who are positive, we want to get those folks into care, because if they're practicing risk behavior, they're not spreading it. If they're on treatment and they're undetectable.
So is that like, because you would say you just don't know. You can't go around asking people, what's your status?
A lot of times they don't know.
Yeah. So, I mean, how do you take something like that into account when you're meeting someone new and you're saying, how do I broach the subject with them? And then
Sure. That's a great question. And that's why I always tell people and my patients that you only know what you know. And I tell the young men who come in my clinic, I said, who are men who have sex with women, I say, look, if you are always wearing a condom every time you have sex with a woman, and 2 years from now, a former partner you had calls you and says, I have a son, there are two things you can say to her. So number one, congratulations. Number two, who's the daddy? Because I'm not it. Why? Because you've been wearing condoms all the time. You know that. Right. You know what you've been doing.
Right.
So anytime you have unprotected sex with someone, you are giving away your power. You're putting yourself at the mercy of that person whom they slept with and all the people they've slept with. And so you are really giving away your power. So my encouragement is to empower my patients and say, don't put yourself at the mercy of someone else. Have non-negotiables going on and say, the time you plan is before you get in the back of a steamy car. You have to plan ahead of time, have condoms around, say this is non-negotiable. And I don't care how good looking you are, I don't care how they tell you you're the most wonderful girl in the world, I've never met someone like you. You don't budge. And you say, no, this is non-negotiable. Because if someone really cares for you, they're going to want what's best for you, and they're going to want you to be comfortable. And if you're not, and if you're not respecting that, maybe you need to ask yourself a question. Is this someone that's worthy of me or not?
That's a whole nother conversation.
Absolutely.
We're out of time, so we're definitely going to have you back, because I have all these burning questions in my mind now. I'm like, wait. So if people want to get more information on what you do and how they can, what's the best website? Or
Sure, you can just go on a search engine and do Outreach Community Care Network. We're located at 240 North Frederick Avenue. We're there off of International Drive, in between Nova and Daytona State, kind of in that area where the Daytona State School is. And our phone number is 386-255-4730.
Give me borrow my glasses.
So that's right. So yeah, we'd love to help you, and we take care of people regardless of their ability to pay. We're getting ready to start working here in Flagler County with Flagler Cares, providing medication-assisted treatment.
Great.
And so we're looking forward to expanding our services northward.
So we're looking forward to having you on again, and thank you for sharing this important message. Just remember, guys, what he says, PrEP and
Condoms.
And condoms are the way to go. So have a great week, and we'll see you guys next weekend.